Video of chapter 3, the pain habit. The clue is in the cue. Enjoy the reading. So would you like to help me with an experiment to understand why you feel pain when you do? For this, I need 3 versions of you. The first version is you resting your right hand on your thigh and gently moving it up and down on your thigh. If you're not in a position to do this, you can simply imagine doing the movement. You should feel the sensation of the touch of your hand on your thigh and it moving gently forward and back. I doubt there's anything else you notice, maybe a question in your head about what I'm getting you to do. All will become clear soon. For the second version, I'd like you to imagine sitting next to the person you really like after a glass of wine, watching a movie, soft music, having had a nice meal together. When you have that image in your mind, I'd like you to now imagine that person placing their hand on your thigh in exactly the same way you did, and then notice it moving up and down gently. What do you feel in this situation comparing it to the first one? In the final version of you, I'd like you to imagine it's late and you're alone on the last train in a big city that you don't know. You're alone on the last train in a big city that you don't know. The doors open and a drunken man gets on and comes over to sit next to you. Now, think how you would feel if he suddenly placed his hand on your thigh and rubbed it up and down like the other 2 scenarios. If you feel different in each scenario, it's because of the version of you who's experiencing that situation. When it's your hand on your leg, you normally feel neutral about your hand on your leg. When it's your hand on your leg, you would normally feel neutral about that without it triggering any significant emotions or changes. When someone you really like touching your thigh, the positive emotions that come with that stimulus and the meaning you give it create different feelings. So you may have felt happy, excited, and romantic. That corresponds with physical changes in your facial muscles, making you smile, blood flow changes in your stomach, causing butterflies, or in your cheeks, causing you to blush. Imagining the third scenario where you may have considered it threatening, the person touching your thigh creates different emotions, and when your viewpoint is framed in a more negative way. Unpleasant emotions of fear or anger may arise. These also correspond to physical changes throughout your body. Your face would have a different expression, your muscles would tense, the thought may make your stomach turn, and the blood flows through your brain differently so you can focus on escape. These 3 contexts result in a different response or output from your brain and have the same from the same stimulus of being touched on the thigh. Different feelings you experience are due to different physiological responses. So place your focus on each scenario of feeling touch on your thigh. Your brain and body prepare you for that environment. It doesn't matter whether it's real or imaginary. The output of each is an entirely different feeling driven by your perception of the people touching you in the environment where it happens. You only react differently because through your lifetime, you've learned the meaning of the other cues present in each scenario. There are different beliefs, emotions, and behaviours for each. Compare your reactions to those of a baby that experience the same scenarios. They have no concept of knowing how to consciously stroke their own leg. So we just simply interpret each stroke of the thigh as more or less the same. Whether that was from their own hand, the hand of a loved one, or the hand from a stranger in a threatening situation. The baby doesn't have the learning to give any meaning that could possibly differentiate from each situation. If they responded at all, it would likely be a reflex response from the touch, as there's no other information or conscious awareness of any other aspects to be able to respond any differently. At that age, there's no beliefs, emotions, behaviours, or good or bad experiences to compare with. How could they act any differently without any awareness or understanding of the cues, which are contextually very different? You react differently because you have the awareness and understand the meaning of the stimulus in the different context to create neutral, romantic, threatening settings through which to interpret the touch. The input from your senses is filtered through what you believe about each situation. That triggers emotions dictating what conscious and unconscious actions you should take. So the reaction to your thigh being stroked would be very different from that of the baby's. The output from the brain expressed in the body is different because of what we believe about our environment. The conditioned conscious and unconscious reactions we exhibit vary massively because of that. As pain is an output from the brain expressed in the body, it's influenced by different situations in exactly the same way. Whether or not we feel pain is dependent on how we interpret certain stimuli in the situation we're in, what we believe about it, what emotions are triggered through that perception, and what behaviours we undertake thereafter. Think about if you suffered a blow to the head in 3 different contexts and you experienced pain with each of them. The blow was in exactly the same place, with the same intensity and the same force. Think about how the output may differ in these 3 different contexts. First pain comes from when you bang your head on a kitchen cupboard, when you're getting up and you didn't realise the cupboard door had been left open. Second time is when you're putting things in the car boot and you bring the boot door accidentally onto your head as you close it. The last pain comes from being hit on the head in an aggressive way by someone who got away with it without you getting any justice. How would you feel about each of these scenarios and the pain that you experience from them? Well, the first 2 are accidents that can happen to anyone. You didn't realise the kitchen door was open. Maybe you had a new car and you misjudged the trajectory when closing the boot and didn't manage to get your head out of the way in time. There isn't anyone else involved, and apart from maybe a little self-berating and making a mental note to not doing that again, that would be all. How do you feel about the other situation when you were assaulted? It feels different because the different emotions attached to that neural pathway which forms to give us a memory of that experience. There may be anger, fear, blame, or a sense of injustice that persists because the perpetrator was not punished or held accountable for what they did. Tissue damage from each is identical, and all will be completely healed within 3 months. No sign of that injury, no pain, even if there's a scar. However, if the memory of the event is coded very differently in the brain and the cues around each are very different, we know that intentional pain lasts longer. But if the tissue recovers in the same way, what makes the pain last longer in one situation rather than another? It's really important that the different cues in each situation are memorized so you can prevent that situation happening again. Emotions create that link. If a strong emotion becomes attached to the time someone experiences pain, it becomes wired to that pathway. That linkage means that it becomes part of that context to be recognized in order to prevent re-injury. It quickly becomes habitual. So we don't need to keep repeating the event to learn it. You just need to feel that emotion and you'll automatically do the behaviors related to it. It's emotion attached to an initial event that creates that habit. The memory sits in the part of our brain we're unconscious of until needed again. Once the cue is recognized, it triggers an emotion. When the triggers, which then triggers a set of automatic coordinated behaviors to prevent re-injury. If it didn't, we would have to repeatedly hit our head on those things many times before we realized it wasn't healthy for us. It's the strength of the emotion which dictates how quickly behavior becomes wired to a cue. The context becomes the cue. So the kitchen cupboard and car boots now present us with cues we recognize. That cue triggers an emotion strong enough to kickstart the habitual protective behaviors, reminding us how we felt the last time we experienced that cue, and we complete the task without re-injury. Fascinating thing is these habits needed very little conscious thought. If you measured the brainwaves of that activity, there's a peak at the start where there's a recognition of the cue. The brain activity during the behavior is tiny in comparison, and then it spikes at the end due to that behavior. The brain activity during the behavior is tiny in comparison and then spikes when the end cue to that behavior is reached. So habits are thoughts, but at such a level of brain activity that doesn't feel like thinking to you. Once it's done its job, it fades into the background where it remains forever. It only rears its head when that context appears in your life again. When the cue appears, the emotion appears, and the protective behavior follows. Then the conditioned response. Pain that has been linked to strong negative emotions becomes a more complicated story. If you saw a car boot open or a kitchen cupboard door 10 years later, you wouldn't tense up with fear. However, you saw the person who hit you and he was walking towards you again with an aggressive face, you would have a totally different physiological reaction because of the cues you recognize have stronger emotions attached. You have very different beliefs, emotions, and behaviors that would prepare you for encountering that person again. Intentional pain lasts longer because it has stronger emotions attached to the memory. It makes sense because it's considered more of a threat. So you need to recognize what you can to stop it from happening again. This gives the person more opportunity to recognize the subtle aspects of a similar situation that might give a clue to this painful thing happening again. Your system is incredibly adaptable at coding pain. It's picking up on information from your senses and thoughts all the time without your awareness. A famous example of this was seen during an experiment that covertly observed students' behaviors following a task. After asking them to arrange words around elderly concepts, they were seen to walk more slowly immediately after the experiment when compared to another group arranging non-old age related words. Without the students even being aware, their brains and bodies were primed with the words to unconsciously think of old age and then subsequently primed to walk more slowly. Incidentally, even reading that information, it's been found to make people walk slower. It's crazy, isn't it? Even reading that passage in the book will make you walk slower. It's mad. If you've experienced something threatening linked to loss of what, I'm not being that clear there. If you've experienced something threatening linked to lots of warning cues and your unconscious system senses these, it has the ability to react to them without your conscious awareness. This protects you from the identical experience or warns of anything similar. We're designed to look out for danger, so the more we can relate to what we have learned and then apply that to similar situations, the more chance we have of surviving them. We can use any successful response to ensure our survival of the next event. We can recognize the danger, evaluate the risk, take evasive action, or take on the risk. That system of protection is amazing, but sometimes it goes wrong. And it's gone wrong with you. Many patients with persistent pain have scars or findings from tests, investigations, MRI scans, or ultrasound scans, and that they believe are the reason for their pain. Yet many others in the population have exactly the same findings without experiencing any pain at all. There's no support for the belief that structural changes are the reason for persistent pain. How can one person recover and you not recover? Why is it that there are so many people like you? Is it because your unconscious sensory system is picking up on cues from context that you may not even recognize consciously and interpreting them as danger? The brain can generate exactly the same pain that is experienced with physical overload or injury with no tissue overload or damage occurring if a certain combinations of cues are present to trigger it. It's the unconscious brain's response to the stimulus, which is excessive. And it's the conscious meaning given to that response, which is mistaken. If you don't understand the true meaning, how can you pick the right behaviors to resolve that pain? Many patients and medical practitioners make the same error in perception. If they don't understand the true meaning, how can they give the correct diagnosis and correct treatment? If the wrong treatment is selected, it'll fail. Why do we make that mistake? Well, physical pain comes with emotions. Emotional pain comes with physical sensations. And both are absolutely real at that moment. The strength of the emotion present from either situation determines how likely it is that the two become linked together and encoded unconsciously in the brain. When they fire with enough emotional intensity, they wire together. This can happen with one moment of high emotion or a sustained level of emotional discomfort. Once that connection's made, is there forever, unless another habit is overlaid with a different emotion in the same way. How many times do you need to burn yourself on the cooker to teach you not to do it again? If you ever felt the pain of grief, you know where you would physically feel that emotion in your body. So we now have a two-way feed into a physical sensation of discomfort or pain. One's due to physical damage or overload, which makes sense. The other one doesn't, because it's triggered by a level of emotional intensity recognized in the unconscious part of your mind. Once a certain threshold is reached, because that emotion in someone's life reaches a tipping point sufficient to trigger that nerve pathway connection, they will feel that discomfort or pain. They feel it even without any tissue overload or damage. And where do we look first when we feel physical pain? For the physical place it is, what's under it, or what other physical places refer to it. The physical aspect dominates our paradigm, our culture, our medical systems, and our society. If we don't find something that fits our understanding, we go for the next best thing. Our medical model of assessment and treatment focuses mainly on the physical aspect with little or no regard for the emotional aspect. If you don't look, you don't see. And the problem comes with persistent pain when the wrong choice is made based on an incorrect perception. We need to understand the true meaning of the stimulus around us, what we are feeling physically and emotionally, and make sense of that. If we get pain without understanding why, it causes fear. If we don't have the answer and are unable to get an answer from someone else, that fear persists. In your desperate desire to get some sense of control, the meaning is given to the pain from yourself or a medical practitioner that makes sense on some level to both of you. It isn't the real truth. It just gives you a reason to believe that you have to live with your pain. If you can see the truth that there are those associations between physical pain and your emotions, you understand how they've developed and resulted in your persistent pain, then you can move easily towards letting go of your pain. So there's some more food for thought from chapter 3, and if you're interested in the next chapter, the link above will take you to chapter 4.